Well, thank you, everybody, for joining in so early in the morning. I'm so excited to be here once again. And this is a great platform for patients, patient advocates, any clinician who provides fibromyalgia care. And I welcome all to tune in and listen. And thank you again for allowing me to present to you. So this is a part 2 of the presentation. The part 1 was last year in 2022, and it's available on YouTube. But I really wanted to elaborate on the nervous system and the emotions and the physical health. Last year, the presentation was more about the nervous system and how our nervous system is connected to some symptoms in fibromyalgia. Today, I want to make a more general connection, not so nerdy in terms of the neuroscience, but what happened to you and why you may have fibromyalgia, chronic pain, or any other chronic conditions. I want to talk about the relationship between the emotional and physical health and how stress and trauma affect autoimmune conditions, chronic pain, and fibromyalgia. Again, this is short disclaimer, this is for information only. I'm a physician, so I don't want to have liability. And I also want you to take this as information for your health so you can actually research further the topics I'm discussing today and maybe bring it to your doctor because this is important information that physicians should be aware of. Again, I'm a board-certified rheumatologist and internal medicine physician. I graduated from the Mayo Clinic in Jacksonville Rheumatology Fellowship that is known worldwide for fibromyalgia care. I'm currently a fellow at the Andrew Weil Integrative Medicine Fellowship. And I also have many hours of additional training in pain science education, PRT, trauma, CBT, IFS, somatics, nutrition, and lifestyle. So again, this is from last year, living in survival mode, how your nervous system may be dysregulated and how it can affect immune system, fibromyalgia, and pain. So if you want to have more information on that, please go back to the Fibromyalgia Community Conference replays from 2022. Now, I know I'm very excited and a little stressed out. So I want to kind of take care of myself, and I want you to take care of yourself. So maybe we can just take a pause and take some deep breaths, just kind of regulate ourselves a little bit so I don't speak so fast. So if you can take deep breath to the count of 4, and then hold it for 7, counts for 7, and then release it slowly to the count of 8. So take a deep breath. Hold it for 7. 1, 2, 3, 4, 5, 7, and take a deep breath out. 1, 2, 3, 4, 5, 7, 8. Take a deep breath again. Hold it. Let it out. Again, take a deep breath. Hold it. And one more time. Hold it and let it out. So hopefully it will help you kind of regulate your nervous system a little bit more and pay attention. I have many references that I use for this presentation. Many books, many courses. Some of them I don't note as references, but if you have any questions, you can always email me or look up those wonderful people who gave a lot of information on this subject. So we're going to go over some concepts today about what is stress and then how stress affects our body and mitigation of stress and the effect of this on our health. So what is stress? I want to tell you, stress is universal and everyone experiences stress every day. Stress is just our body's response to pressure, challenges, or anything that comes up. It's a natural human response that prompts us to address challenges, threats in our lives, in our environments, with other people. We have many types of stress in our lives, but we have 3 types of stress that we can identify. One is eustress. It's a good stress. It's motivating, it's inspiring. If we get stressed out a little bit to motivate ourselves in January to start a new diet or exercise program, when we travel and change our environment, when we have a job interview, or this presentation, or if we're dating somebody new, have a new relationship, or have a gathering of people that you love for Christmas or holiday or birthday. This is all example of good stress. It inspires us, but it activates our nervous system a little bit to make us do stuff. So we don't lay around and not do activities. Kind of makes us going and move through the life. Then we'll have a neutral stress or new stress. It is kind of information we can receive that kind of stressful, but really doesn't affect us. It can be news you read in a newspaper, for example, volcano eruptions in some island or tornado that did not affect your community, something that is neutral, but it still can be perceived as stress. And this is distress. This is the bad stress that most of us think about. Anything that perceived as threatening. It can be work-related stress, the traffic, it can be your mother-in-law visiting, anything that activates your nervous system in a negative way. Now, there are many, many types of stress, but we usually identify stress as a short-term or long-term. Now, short-term stress is intense and it goes away rather quickly. It can be travel-related stress when you miss your flight. It can be loss of a job. It can be flu or any other infection that has a short, resolution. It can be a fire in a neighborhood or that affects you or somebody else you know. And it can be trauma. It can be shock trauma, such as somebody who robbed you or assaulted you. So this is a short-term stress that's intense, but it goes away rather quickly. And then we'll have a long-term stress. This stress is chronic, ongoing. It may arise either intensely or less intensely, but it lingers. And your body feels that it's perpetually aroused for danger. Instead of having a fight-or-flight response to a tiger in the wilderness, when it's there very quickly, it either eats you or you run away, you feel like you're living with a tiger in your living room. You continuously having the fight-or-flight response of your adrenal system or your hormones, your nervous system is activated, you have symptoms of activation, and that can go on for years. And that stress, we're going to talk about today, how that ongoing, long-term stress affects your health. Now, we have many, many stressors in our lives. Again, a stressor is a situation, circumstance, or stimulus that is perceived to be a threat. Now, it doesn't have to be a threat. And what's threat to one person may not be a threat to somebody else. Now, stressors alter the balance in the body, how our hormones regulate, how our body functions, how our mind functions, nervous system. It alters the balance in the body. So we may have psychological stress, our thoughts, beliefs, perceptions. Our thoughts cause a lot of stress. Our thoughts create feelings that lead into actions and the result. So if your thought is extremely stressful or creates a feeling of threat in your body, will create a feeling or emotional response or physiological response that will create a result in your body. Your heart rate may go up. You may have some, sweaty palms. Your mind, your body can get activated. So psychological stressor is a thing. If you're thinking about losing a job, just think about it. You don't know you're going to lose a job, but you think that you may. That thought creates anxiety, creates stress, creates symptoms, even though it has not yet happened. Then we have physiological stress. This stress is, again, we not think of as stress, but any illness, infection, any disease, hunger, or pain is a stressor. When we have infection, not only we feel horrible, it creates a physiological response in our body. We also have consequences of illness, missing job, it disturbs our social environment, if you have children, it creates additional stress that is maybe social or psychological, but physiological stress does alter your body. It can create heart rate elevation, create effect on your immune system. It can cause pain. So physiological or body response is there's also stressors of that type. Social stressors are very common. It can be anything from traffic or commute to work. It can be major life changes like having a baby or getting married. It can be good stress or bad stress, but there are stressors. Personal conflict, arguing with a spouse or your children or having teenagers, financial insecurity. Those stressors affect our daily life. And also, if they're prolonged or lingering, if we're constantly living in the conflict either at work or at home, if we're constantly stressing out about finances, paying up bills, if you have daily commute to work and from work that is in traffic, that's heavy traffic, when you have, irresponsible drivers around you, it creates a stress response in your body with your hormones going up, with your body, with your heart, with your lungs. So social stressors are common and have profound effect on your body. And then we also have bioecological stress, the weather, pollution, food additives, chemicals. Those things also affect our body in a negative way very often. What we eat matters. If we eat chemicals from fast food or colors that are added to our sprinkles or cereals, even though we don't perceive it as a stress, it is a stress that affects our body. It puts our body sometimes on a defense, again, alters our hormones, our immune system. Another stress is trauma. Now, trauma, I can tell, just like stress, is universal, and I will talk more about it. But trauma is anything that is too much, too soon, or too fast for our nervous system to handle, especially if we can't reach a successful resolution. It may be too much arguing when you were growing up at home. It may be too soon being exposed to sexual behaviors of others, such as pornography or somebody's advances. It may be too fast, experiences that came on too fast that you couldn't understand or handle, especially if you didn't have somebody guiding or helping you through that event or series of events. Again, trauma is often not about the event. It is about the individual response to that event. Not every event will cause that response in every person. If we have a fire in the classroom, the effect of the fire on the kindergartners, the teacher, and the firefighter will be different. The teacher may be stressed out about keeping her students safe. The students may be fascinated, but also stressed out about that fire and evacuation. And then the firefighter will be all activated to go and fight the fire. But the response on their bodies, their memories, their perceptions, their arousal state will be different. So trauma is not about the event. It's the body's reaction. Again, we have two types of trauma. And most of us think of trauma as a short-term trauma. It's intense, it goes away quickly, it may result in PTSD or post-traumatic stress disorder. We think of it as shock trauma. Those are the plane crashes, school shootings, somebody gets assaulted. That has happened, it's horrible, but it has a defined time frame. Now, most of us, or many of us, may never experience the shock trauma or short-term trauma, and it's a good thing. And I'm sorry that if somebody had experienced the short-term trauma. But most of us, or many of us, have experienced long-term, chronic, ongoing threat or danger. Again, this is when we live with a tiger in a living room, when we have this survival response, the fight or flight response that is ongoing. Again, just like trauma, just like stress, trauma is universal. But also, I just want to point out, it can be multigenerational. I have many patients who will tell me, my childhood is perfect. I don't have any recollection of any trauma as a child or as an adult. But they may have multi-generational trauma from slavery, the Holocaust, forced migration, violent colonization. It's a lot of things that can happen to our parents or to the baby in utero. We now know that if mother experienced a lot of stress through pregnancy, if she lived in dangerous neighborhood, if she worried about her safety, if she worried about providing for her children with financial insecurity, if she lived in a dangerous environment with dangerous spouses or significant others, that baby had exposure to her stress, and it affected the baby. So trauma is universal. It is what it is. We have survival responses. Our bodies were designed for that. But unfortunately, it has health consequences. Many of them are reversible. So I want to give you hope. If you feel like this is all I'm telling you is a gloom and doom, I want to tell you it is not, but it helps you understand maybe why you may have fibromyalgia, chronic pain, in other health conditions. Knowledge is power. So my conversation today is about empowering you to know what may have happened to you, why. Many patients who see me in the clinic, they want to know why. Why do I have fibromyalgia? Why I'm in so much pain? Why I always feel stressed out? Why I have rheumatoid arthritis or lupus or other autoimmune conditions? Why? So this hopefully will give you some answer of why stress and trauma affects our health. So this is important information that a lot of times is missing in the conversation with your doctors. And I don't even remember covering it in the gazillion amounts of information in medical school and other training. If it did, it wasn't important enough or big enough news for me to remember. Adverse childhood experiences should be foundational knowledge that every physician, every clinician, every physical therapist, any provider of healthcare or childcare or teacher should know, understand, and use. So childhood trauma and adversity that happened before age 18, from zero, actually before zero in utero, to all the way to age 18, plays a major role on our health. Again, what happened to you before age 18 has negative consequences to your health when you are an adult. We're not talking about health of children. We're talking about health of adults. This study came out in the 90s from California insurance company called Kaiser Permanente and the CDC. So they studied over 17,000 people in California who all had health insurance, who were usually, most of them were middle class, not living in a horrible neighborhoods or in danger. They were studied and analyzed about their health as adults, and they studied their childhood. And they used different scales of analysis to see what happened to them as children and how that presented, or how it affected them as adults. And this study is still ongoing, and this study has been replicated in many other states and countries around the world. So this is not just one study or one example. So this study started in the 90s, but it's actually being used as the model to study chronic diseases in adults in many other countries and cities and states. So that study used a scale of 10 adverse events or ACEs that may happen in somebody who is a child, again, from 0 to before age 18. If it counts 1 point for any of those experiences, so if you had multiple, multiple experiences of verbal or physical abuse, it still counts as one event. Physical abuse, verbal abuse, sexual abuse, having sexual contact with somebody older than you by 5 years or an adult, physical neglect, emotional neglect, losing a parent to separation, divorce, or death, a family member who is depressed or diagnosed with other mental illness, a family member who's addicted to alcohol or another substance, a family member who's in prison, witnessing a mother being abused. Now, in later studies, they expanded this scale to include a father being abused by a mother, a sibling being abused, witnessing homelessness or unstable housing, discrimination, bullying, any like hunger. So they expanded the scale, but this scale was used in the initial study, and it's still kind of the classic screening for adverse childhood experiences. Now, you can easily Google the scale ACEs and calculate it and see how many you may have, how many adverse childhood experiences you may have. I want to also tell you there's another scale that's very important, actually multiple versions of scale, called resiliency scale. The scale is also important and should be taken probably at the same time as the ACE scale, because sometimes when you take the ACE, it makes you so sad and depressed, but the resiliency scale shows you how many good experiences you had in your life. So they can actually show you how having a grandmother or somebody like a mentor in school or a friend, those experiences also count towards your health and towards your outcome. But today we're focusing on stress and trauma. Again, this is how your adverse childhood experiences may cause health outcomes in the adult. And the study found astonishing results. Almost 2/3 of people, 67% of the entire population, has at least one traumatic experience. How often are divorces? Very often. Half people get divorced or even more. How often we have somebody in a family who has depression, anxiety, or mental illness. So we may not perceive it as adults now as trauma, but it is. We know that having divorced parents as in adults causes health consequences. Having a parent or somebody in your family with mental health issues or addiction, like alcohol addiction. Talk about 60s and 70s. How many people consumed a lot of alcohol because it was normal, or other drugs? Now those children are adults today. So if you look at the scale and look at the consequences to our health, again, 67% have at least one ACE. 1 in 6 experience more than 4 ACEs. 4. And the consequences of health are traumatic. At least 50% or 5 out of 10 leading causes of death. Again, 5 out of 10 leading causes of death in the world associated with ACEs. This is the health consequence of enormous health consequence. If you have 4 or more ACEs, you're more likely to have lung disease and be smoking. You may have more suicide attempts or thoughts of suicide. You're more likely to have depression, liver disease, drug use, have sex before you're age 15. This is real. This is there's evidence for it. Somebody can measure it. It is studied. So it's not imaginary. Stress, trauma causes diseases of adulthood. Now, potential reduction of negative outcomes in adults. So this is, again, from CDC. If we reduce childhood stress, if we reduce those ACEs in our children, how much better their health will come in the future. Again, this is ongoing studies. So we're kind of looking at the numbers. They may not be as impressive, but again, 44% reduction in depression. COPD, because people smoke less. Smoking goes down by 33% when we reduce the stress in children. Heavy drinking reduces by 1/4. Unemployment, finishing high school, having health insurances all improve if we reduce stressing our children. But if you also look at these health conditions that are studied, you will see that depression, COPD, asthma, kidney disease, stroke, heart disease, heart attacks, cancers, diabetes, obesity, if they're studying reduction of that, it means the ACEs are causing those conditions. We're not going to study reduction if there was no connection between those conditions. So ACEs are linked to chronic health problems, mental illness, substance use, and problems in adulthood. And we know through decades of research that ACEs have risk of developing, causing the development of chronic diseases and behavior challenges in adults, including obesity, autoimmune diseases, fibromyalgia, and chronic pain. If you have more than 2 ACEs, your risk of autoimmune diseases, chronic pain, fibromyalgia goes higher. Diabetes, heart disease, cancer, poor mental health, alcoholism, and reduce life by as much as 20 years. So again, childhood stressors causing adult diseases, and many of them are preventable. And then if you are having all these conditions, or again, childhood stress or any other traumatic events, it will impact your education, job opportunities, earning potential, that also will increase your stress in adulthood. But what about ACEs and fibromyalgia? Now, there have many studies. I didn't pull up all the studies, but if you search ACEs and fibromyalgia, you will find many studies. There were studies in 2012, 2010. There's a lot of data coming out in those years. But recently, we had in 2020 a large-scale population-based study that reported that childhood trauma is associated with significantly higher risk of developing fibromyalgia later in life. Another study in 2022 found that 88.2% of people with fibromyalgia had experienced childhood trauma. Now, this is not a surprise, right? 1 in 20 people in the world may have fibromyalgia. I think the number is underdiagnosed. And 1 in 6 people have more than 4 ACEs. 1 in 4 women had a history of sexual assault, and 1 in 6 men have history of sexual assault. So if you look at amount of trauma and stress that is experienced by humans, again, it is universal. We can understand why so many people in the world have experienced chronic pain and fibromyalgia and chronic fatigue syndrome and other health consequences. Again, looking back at common fibro triggers, this is just a reminder. I put trauma as number 1. I have not met one person yet in my clinic who have not had some type of trauma, some type of ongoing or severe stress. Many of us had infections, severe infections, hospitalizations. COVID is a stressor now. We can add that to the list. Many have prolonged hospitalizations. Medical trauma also is a thing. Going to a doctor for 3, 5, 10 years and not getting diagnosis, and finally getting diagnosed as fibromyalgia with all the stigma and all the mistrust in the community, it is traumatizing as well. Injuries, car accidents, whiplash, falls, fractures, childhood sports-related injuries, all are common triggers, identified triggers of fibromyalgia. So we'll look at stress, trauma, and our health. And again, those are very common triggers for fibromyalgia. So how does our body respond to stress? Our body was designed to have this response to stress when we're being hunted by a tiger, right? When we lived in a primitive time, a primitive, caveman world, and we did not experience the ongoing stress that our modern society experiences. So our body has this pre-wired fight or flight response. And this was the talk of my presentation from last year. Stress response is wired in our in our body for a reason. We're supposed to experience stress. Remember, 3 types of stressors. We're wired to have good stress, with neutral stress, and distress. So our stress response is not, is wired. Our body is designed to experience this. It's a part of our autonomic nervous system response, and that is involved. It involves our hormones, our heart, our vagus nerve. Everything is related in terms of how our body responds to stress. But the major mechanism is of this stress response is hypothalamic pituitary adrenal axis activation and release of the acute stress hormones of epinephrine and norepinephrine, and also release of cortisol or chronic stress hormone. And many of us know that those concepts. But what about the symptoms? Many of us have experienced them. Right now, I'm a little anxious because I'm giving presentation. I'm sure my heart rate is up. I feel palpitations. I speak faster. I have shortness of breath. I have sweaty palms. Those symptoms of stress are common. If you ever had a test, if you ever had stressful interaction in traffic, if you had somebody visiting you unexpectedly, you may feel those symptoms. But those are kind of short-lived, symptoms that tell you that your nervous system is activated. Many people feel the symptoms chronically, ongoing. Again, anxiety, palpitations, shortness of breath, sweating, irritability, fatigue or excessive tiredness, loss of appetite or increase in appetite, overeating, dizziness, nausea, indigestion, diarrhea. Almost 100% of people who have fibromyalgia also have IBS. Headaches, tremors, unusual emotional feelings, difficulty sleeping, night sweats, or nightmares. Those are stress-related symptoms that many people have all the time, not only when they're acutely stressed, but chronically stressed out. Then also there's psychology of trauma. How many symptoms, psychological symptoms, we have experienced or experiencing because of history of trauma that has not been processed, healed, or reframed? Anxiety, depression, dissociation or daydreaming, dysregulation of the nervous system, insomnia, hypervigilance, waiting for the other shoe to drop, being aware of your surroundings 24/7, being mindful or watchful of people's expressions. Are they having a good day? Are they going to hurt me? Are they happy, unhappy? Are they going to be loud and argumentative? Hypervigilance is a very common symptom of childhood trauma or ongoing stress. Numbing with alcohol, food, sugar, drugs, pain. When you're stressed out nonstop, it stresses your muscles. It puts your nervous system, activates all the muscle response and posture and your skeletal system. It is a known cause of pain. If you're stressing all the time, you will have more tension in your neck, in your back, in other muscles. So pain and again, the tension, the cramping is very common. Also, blame, shame, feeling of betrayal, attachment issues, attachment problems with childhood, how you relate to others now, diminished self-care, loss of hope. Many of my patients report me many or all of the symptoms, and many or all of these symptoms, physical symptoms, psychological symptoms. So if you have those symptoms or the activation of your nervous system due to stress or trauma for a long, long time, sometimes it's not that long, it may be just a few months or years, but often people will not, again, 0 to 18 is 18 years, and then stress of being a teenager or adolescent and then young adult. No wonder we start seeing consequences of that stress in our 30s, 40s, or sometimes younger. We have children who have ulcers and other health issues. But we see that propagation of bad health through the years. The longer we live with stress, the more conditions we will accumulate over time. Health effects of chronic stress: impaired immune function, more infections, autoimmune conditions, arthritis. We see that it also affects inflammation. Inflammatory conditions are common. Inflammation has many functions in our life, including prevention of diseases like cancer, cardiovascular disease, infection reduction. So impaired immune function and inflammation causes a major effect on our health. Decreased bone density. Many people are surprised by that. Osteopenia, osteoporosis, again, all those hormones are affecting your bones. Problem with memory. Now, there's no direct cause of dementia from stress, but we know that people who have more stress often have memory problems and dementia. Dementia can also be part of the inflammation, and just like cardiovascular disease. So again, if you have problems with inflammation, problems with heart disease, and other consequences of inflammation, you may also have dementia. So, but problems with memory, the brain fog is so common. Again, if you're hypervigilant, if you're constantly scanning for danger, if your body is aroused, it diminishes the available neurons in the brain to process other information or store memories. Increased appetite is seen in ongoing stress. Again, when we have sometimes acute stress, we don't want to eat. People say, if I have the flu, I may not eat anything for 3 days, I'll lose weight. But ongoing stress, we see that weight gain, obesity, abdominal fat deposition, increased appetite is very, very common. Insulin resistance, increased glucose and cholesterol is very common. We also know that the depression and diabetes often connected. We see patients who have type 2 diabetes often have depression, and depression is an independent factor for heart disease. So again, insulin resistance, increased glucose, cholesterol, increased blood clotting, and platelet dysfunction, impaired wound healing, poor sleep, sleep disorders, pain and fatigue, poor mood or mental health disorders, cause of development of blood pressure, high blood pressure, hypertension, diabetes, heart disease. Stress causes disease. Adaptation of less healthy habits and substance use, and decreased lifespan, not because of all the substances or other health issues, but because our telomeres or our DNA gets smaller. So we know that it's not just all the issues causing our shorter lifespan. But if you look at fibromyalgia symptoms, just to connect the dots, all the symptoms we'll talk about, we see in fibromyalgia patients: widespread pain, pain all over. People tell me muscles hurt, joints hurt, even my skin and hair hurts. Touching hurts. People have stiffness, fatigue out of proportion to age and activity, exhaustion, malaise, headaches, tension headaches, migraines, dizziness or lightheadedness, problems with thinking, memory, concentration, brain fog, sensitivity to touch, smells, bright lights, or noise. This is overstimulation of the nervous system. The nervous system cannot handle so much input. Episodic numbness or tingling, difficulty sleeping, unrestful sleep, insomnia, sleeping too much, not getting enough rest, difficulty falling or staying asleep. As you can tell, those symptoms are real, and many of them can be related to the ongoing stress or the past history of trauma. So what do we do with this information? What is your call to action? I want you to be empowered by this information. I don't want you to take this information and say, there's no hope. My fibromyalgia is here for good. There's nothing I can do. My pain is going to be here forever. I want you to take this information and empower yourself to do more for yourself, to do more for your health. Because health is a state of complete physical, mental, spiritual, and social well-being. It is not mere absence, prevention, or control of disease or symptoms. Again, having no fibro symptoms is not health. Having, again, complete physical, mental, spiritual well-being. How well are you living your life? You are not your disease. And there's many things you can do to improve your overall health. Some conditions may be already taking toll on your health, but many of them are still reversible and modifiable. Again, looking at the potential reduction of negative outcomes in adults. If you look at, that 88.2% of fibromyalgia patients have childhood trauma, they also experience these conditions, right? So if you have fibromyalgia, you may also have depression or COPD because you smoked, or you may have a higher risk of stroke or heart attack or cancer or diabetes. What can you do for your health, not just for fibromyalgia? What else can you do to offset all those conditions? Now, I don't want to diminish suffering from fibromyalgia, and many patients who have fibromyalgia feel powerless because they are in chronic pain. They're often tired. They're struggling with the symptoms. But putting all emphasis on fibro and ignoring these other health concerns that are modifiable, reversible, treatable is important. Your nervous system may have been dysregulated for many years. You may feel disconnected, threatened all the time. It impairs your breathing, digestion, healing, mood, blood pressure, sleep, hormones. But we can also regulate our nervous system. We can start regulating our nervous system now by taking breaths, having deep breathing, by starting yoga. Yoga Nidra is a phenomenal tool to regulate our nervous system when everything else feels dysregulated. Taking 20-30 minutes per day of Yoga Nidra showed that you have more nervous system regulation, better sleep, more dopamine in your brain, just doing 20 to 30 minutes of yoga per day. Eating proper nutrition, healing your digestion. Again, stressors. Bad food is a stressor. Improving quality of food removes that stressor. Exercise, moving your muscles. Again, with fibromyalgia, we know that too much exercise causes pain, but gradually increasing movement, gradually improving circulation in our muscles creates, again, positive response to your nervous system and reduction in pain. Has been studied by Mayo Clinic and many other organizations or studies show that physical activity improves depression, chronic pain, and fibromyalgia symptoms. So this is not just my talk. This is from the VA system in the United States. VA system or Veterans Affairs organization has this concept of whole health. And I came across with this past summer. I guess, again, I've learned about it before, but it was really impactful when I was learning integrative medicine through my fellowship. And they talked about how our health, how our whole health has impact on our lives. What is whole health? Again, this is from the VA. Their concept is not just prevention and treatment of disease or conventional complementary approaches. Look at it. The disease management is the outside. It has much smaller proportion of your health than this concept of me, mindful awareness, moving your body, your surroundings, personal development, how well you live and work, what you eat, what you drink, how much you sleep or recharge, your community, family, friends, co-workers, relationships, your spirituality. Spirituality has a huge impact on your health and often not talked in our healthcare system. A lot of patients crave spirituality discussion with their providers, and it's missing. Power of mind, relaxation, healing, yoga. As you can tell, this is you, and this is what you can do or improve. This is the circle that is your conditions. That is fibromyalgia or heart disease or whatever diseases or symptoms we might have. And then community is important. We don't live in isolation. So this is the concept of whole health by the VA system in the United States. Me, self-care, professional care, community is whole health. And I wanted you to pay attention to this because a lot of patients who see me complain, my doctor doesn't listen to me. I go to so many doctors and no one knows what's wrong with me or what to do with me. The medications don't work. The consultations don't help. I did pain management, it didn't help. But if you look at this concept, only 1/4 of your whole health depends on a professional care. Now, I don't want to minimize it. It is really important. Medications save lives. Heart stents save hearts. But a lot of it is in your control. You have more control of your health than you think. This is the lifestyle medicine, American College of Lifestyle Medicine interventions. This it's a medical specialty. You can take a board exam on this. It is how can you reverse diabetes? How can you reduce your risk of heart disease, high blood pressure, cancer? The studies are phenomenal of reduction of cancer rates using those lifestyle modifications. Again, they're focusing on non-medicinal, non-pharmacological treatments that should be offered to every patient, regardless of disease, initially. So if you have diabetes, before we put you on metformin or insulin, those should be offered and used before the medications. Healthy nutrition. And lifestyle medicine proposes whole plant-based foods. It can be also Mediterranean or autoimmune protocol. Dramatic effect on our health. We can reverse diabetes by and impaired glucose by using nutrition. Physical activity, important. There's a prescriptive physical activity, but some physical activity, improvement in sedentary lifestyle is so important. How you manage stress, how you sleep, what kind of relationships you have, and how you can improve it. It can be, family, it can be extended family, it can be going to places of worship, community, again, relationships, and avoiding risky substances. I know that many of my patients, especially I live in Kentucky, smoke, use alcohol, use other drugs to numb the emotional symptoms. But also, food addiction is very common, overeating, stress eating. So I'm kind of lumping all those risky substances in this big category of doing risky behaviors that affect your health. But if you modify or reduce or improve, those focuses, and again, nutrition, physical activity, stress management, sleep, relationship, your health will also improve. Your symptoms of every condition you may have, including fibromyalgia and chronic pain, will improve. I have not met one patient who told me, I have done all of this and I don't feel better. You will feel better. I'm not sure to what degree, I'm not sure for how long, but the more consistent and focused we are on those modifiable lifestyle interventions, the better our life will be.